And at the same time, we have the robot drilling the first relief well, which, based on what we have heard so far, will not be finished until mid-August. So BP is conducting what we call ranging runs to precisely locate the steel casing in the Macondo wellbore. If we are fortunate, then this attempt will be successful in trying to stop the oil flow, but I believe that to relying on relief wells, however, will not be enough to protect our coast from future disasters. I believe that it is imperative that this nation, as with Russia, Australia, and the Scandinavian countries, develop a comprehensive oil spill response plan. The senator has already addressed in detail the effect of the moratorium, so I will not go there. And she also addressed the needs for the state to have revenue sharing. And I will not address the issue, but again, just to reemphasize the importance in allowing Louisiana to have accelerated oil revenue sharing so that we have the resources available for us to rebuild our coasts and to rebuild our shorelines. One of the more important issues that is impacting my people is the issue of mental health. Everyone I've talked to has told me the social and the mental health consequences of the oil spill will be deep and will be felt for the long term. This is because the effects are compounded due to trauma suffered as a result of previous disasters. There is a great and an immediate need for integrated mental health and physical health and human services because we, to ensure effective individuals are being appropriately identified, monitored, and treated. We need dedicated resources that will help build a stronger term capacity for health outreach and services for the affected region that doesn't currently have the capacity to provide these services on the mass scale required. It is important these services provided are locally available, culturally competent, and language appropriate. It will be difficult to fully assess the effects of the oil spill on people's stress levels and mental health at this time, but in the months and years to follow, we will likely see a large surge in mental health related issues, addiction, suicide, and physical health ailments triggered by untreated or undertreated mental health problems. One of the greatest problems is that the most affected communities are those who do not typically seek mental help or help of any kind, whether it is because of cultural norms, language barriers, pride, financial woes, or lack of recognition of a problem. We have already seen an increase in those seeking mental health assistance and an increase in suicides, but we are still limited in our ability to address, fund, identify, or provide resources for these services needed. If left untreated, we will see spikes in other woes such as homelessness, unemployment, lawlessness, and physical health ailments. So I would recommend Secretary Sebelius make mental and behavioral health needs of this community her top priority in her overall assessment of the health crisis, and that she appoints a coordinator for these initiatives immediately. I would recommend that HHS must work with LADHH to develop an action plan for responding to the immediate, intermediate, and long-term mental and behavioral health needs, including overall health assessment and health action plans. I also recommend Secretary Sebelius take up as a priority BP's denial of Louisiana's DHH request for mental and behavioral health funding, and that she immediately dedicate funding to the mental and behavioral health response. The cleanup, economic rehabilitation, and crisis mitigation revolving around the BP oil spill disaster is something that this public will have to address for decades. For the Gulf Coast, the effects will even last longer than the effects of Hurricane Katrina. As we saw in the aftermath of Hurricane Katrina, a majority of Asian Americans living along the Gulf Coast, most of whom were Vietnamese Americans whose unique needs were not met by emergency authorities. Tens of thousands were forced to seek initial relief in their own ethnic communities. There was a lack of culturally and linguistically competent government and relief agency workers, or even a plan to address different ethnic populations in the case of an emergency or disaster, and large gaps in services and advocacy for Asian American communities, as well as unbalanced resource allotment and mistakes by disaster response agencies. We see the same problem here with respect to the oil spill, in which minority communities, from Asian Americans to Hispanics to African American communities, their needs are not being adequately addressed because, as we have seen in the past 2.5 months, as well as in our experience from recovery of Katrina, the minority communities have very specific needs, and they do need specific programs that are ethnically and culturally centered in order to better address the needs of the minority groups. And lastly, I just want to point to the vessel of opportunity programs and deficiencies that I see there. At this point in time, there seems to be a lack of coordination in the vessel of opportunity programs. We have hundreds of boats standing idle while oil is encroaching on our shores. At the same time, there seems to be, I guess, parish politics that are involved, in which members of, for example, Orleans Parish, when they go into St. Bernard or when they go into Plaquemine and seek employment, are denied employment. So we have, I guess, these turf wars that are going on that we need to address. The oil spill affect many more people than simply those who live in Plaquemine and St. Bernard, Orleans, Chafflin Parish, all along the coastal areas of the state. Everyone is being impacted. So those are some of the areas of concern that I would like the Commission to pay attention to, and I hope that some of the recommendations that I have provided will be heeded. Thank you very much.
Thank you for your statement, Congressman. Those several of the points you made are new to us. We had not had presentations touching on those issues today. Congressman Scalise.